Hello and welcome to Medical Dialogues. I'm Anshika Mishra. Let's look at today's top news. Government rejects study alleging 11.9 lakh excess COVID-19 death, calls it misleading. On Saturday, the Union Health Ministry dismissed findings from a study in Science Advances which claimed India saw 11.9 lakh excess death in 2020 due to COVID-19. The ministry criticized the study's methodology, highlighting its reliance on a non-representative subset of the National Family Health Survey 5 and the potential biases due to the timing of data collection during the pandemic's peak. Contrary to the study's claim about the weakness of India's civil registration system, the ministry emphasized the robustness of CRS, noting it captured over 99% of death by 2020 and increased from 75% in 2015. The ministry also pointed out that the CRS showed a rise in death registration by 4.74 lakh in 2020 compared to 2019, consistent with previous annual increases and not solely attributable to the pandemic. Further disputing the study, the ministry cited data from India's sample registration system, which indicated no significant increase in mortality in 2020 compared to 2019. Additionally, the study's finding on higher excess mortality among females in younger age group contradicted existing data showing higher COVID-19 mortality in males and older populations. Furthermore, the ministry deemed the study's estimate of 11.9 lakh excess death as a grossly misleading overestimate based on flawed methodology and inconsistent results. Surat doctor accused of Rs 5.25 crore ambulance business scam, duping 12 colleagues. A doctor from the Surat Municipal Institute of Medical Education and Research was arrested by the Economic Offences Wing of Surat Police for allegedly defrauding 12 doctors of Rs 5.25 crore in an ambulance business scam. The accused, a tutor at the medical college, convinced his colleague to invest in two ambulance services, Sunshine Ambulance Service and the Young's Ambulance Service, promising a 50% profit. He claimed that each ambulance dispatched out of state would earn Rs 1 lakh and even fabricated a contract with JSW Steel, falsely claiming it has secured a deal to provide 12 ambulances. The scam was uncovered when a complaint was lodged with the crime branch in May 2024, leading to an FIR registration. The defrauded doctors, who received no profits, approached the police. The accused had been evading capture by relocating frequently, including stays in Varanasi and various dharamshalas in Gujarat. He was finally apprehended when he returned to his residence in Surat to visit his mother. During interrogation, he admitted to his movement and evasion tactics. The court granted the EOW a 5-day remand for further questioning. The investigation continues to locate the funds he had collected from his colleagues. Nasha, Mukti, Indradhanush, Abhiyan, India. Doctor-led initiative targets addiction-free India. The Nasha, Mukti, Indradhanush, Abhiyan, India campaign aimed at achieving an addiction-free nation has garnered substantial support from over 1,000 doctors, public health experts and medical students. Launched by the Asian Coalition for Health Empowerment in collaboration with Doctor Against Addiction, this initiative seeks to create a healthier India by eradicating addiction. Dr. Narendra Saini, former General Secretary of the Indian Medical Association, highlighted the campaign's significant response over the past 8 months. The collected signatures are being presented to health organizations and policymakers, including the Prime Minister's office, to advocate for stringent tobacco cessation measures. The campaign extends its focus beyond tobacco to address addictions such as drugs, alcohol, and smartphone overuse, aligning with the United Nations Sustainable Development Goal 3, which promotes well-being for all ages. Dr. Pawan Gupta from the BLK Max Super Speciality Hospital, Delhi, stressed the integration of global best practices with local insights to create a robust framework for tracking addiction. Dr. Susaina Soni from Shubharti Medical College, Meerut, noted that overwhelming support from the medical community, which underscores the campaign's significance. She believes the signature will drive critical policy changes, making a tangible impact on the fight against addiction, inspiring hope and accountability for a healthier addiction-free future. NEET 2024, high-scoring candidates file intervention plea in Supreme Court for retest. Amid ongoing legal dispute regarding the NEET UG 2024 examination, a group of high-scoring candidates approached the Supreme Court on July 22, 2024 seeking a retest. These candidates, who scored over 640 out of 720 marks, filed an intervention plea. Among them, 6 candidates scored above 600 marks, with some reaching as high as 690 marks. Despite their high scores, they expressed concern over the unprecedented inflation in this year's result, where 67 candidates achieved perfect score, jeopardizing their chances for admission to government medical colleges. The petitioners argued that the integrity of the NEET UG 2024 exam had been compromised. They highlighted the impracticality of cancelling the entire exam but proposed a retest for 13 lakh candidates who met the cutoff score of 164 marks. This, they argued, would ensure that meritorious students are not denied justice and would be a more feasible solution in terms of cost and manpower. They also emphasized the limited availability of 55,000 government medical seats, which are crucial for students from modest backgrounds, as private medical seats are prohibitively expensive, ranging from Rs 50 lakh to Rs 1 crore. During the Supreme Court hearing, advocates representing the petitioners, including Advocate Huda, Advocate Helge and Advocate Nedumpara, supported the call for a retest to maintain the exam's integrity and fairness. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe and press the bell icon.